Ladies and gentlemen, in this video, I want you to understand the basics of this disease that causes heart attack. And this disease is called as the coronary artery disease. Now, this is the disease of the artery that supplies the muscle of the heart. And any obstruction in this artery causes a heart attack. As you can see here, this obstruction or blockage is what we call it as plaque. Technically, we call it as plaque. There are two types of plaques. One is a soft plaque and the second one is a hard plaque. The soft plaque is very unstable and it is extremely dangerous. It occurs in about 80% of the cases that causes heart attack, whereas the hard plaque is more stable. It occurs in 20% of patients having a heart attack and it's a little less dangerous. A soft plaque has a consistency of the yellow yolk of a raw egg, whereas the consistency of the hard plaque is like the yolk of a hard-boiled egg. So that is the difference. A soft plaque is comparatively easier to manage if it is brought in time. You can manage it by angioplasty or by giving medication. And a hard plaque is the one that would need an emergency angioplasty. Now, ultimately, what happens is the inner lining of the coronary artery is damaged somewhere, which is called as the endothelial dysfunction. So if there is a lesion, a small erosion of the inner lining of this artery, then the bad cholesterol, which is called as the LDL or the low density lipoprotein, that enters through that disruption into the inner lining of the artery. See, as there are three layers of the artery, an intima, a media and adventitia. So this bad cholesterol enters between the innermost lining and the second lining, that is between intima and media, and it goes down and it progresses by a biochemical reaction, and slowly over a period of time the block increases in diameter. So coronary artery disease is an obstructive disease of the artery which supplies the muscle of the heart. The inner diameter gets narrowed, causing an imbalance, a complete imbalance between the demand and supply ratio of the blood supply of the heart. Now, any narrowing which is less than 70% or 75% is considered as subcritical block, and mostly these patients do not have symptoms or like pain in the chest or breathlessness. But as the lesion progresses and any block which becomes more than 70 or 75%, it is called as a critical stenosis or critical blockages, and that can give rise to the symptoms. Especially the main symptom is pain in the chest, which we technically call it as angina pectoris. So what is a heart attack? A heart attack is an emergency situation where there is a sudden 100% blockage of the artery that supplies a segment of the heart. Now the area of the muscle that is supplied by that artery gets devoid of blood supply, and this muscle can sustain this deficient blood supply up to maximum 6 hours. So up to 6 hours, if you can restore the blood supply either by medication or by doing an emergency angioplasty, then that part of the muscle of the heart will remain viable. But if you cannot do it, those 6 hours are called as the golden hours. So after 6 hours, if the patient comes to the hospital, comes late, or nothing is done within those 6 hours, then that part of the muscle gets completely damaged, and that's a permanent damage, as a result of which the contractility of the heart goes down. So now let's see what are the various causes of these sudden blockages of the artery giving rise to heart attack. The first and the foremost is progression of the disease. Like you have a block which is identified on angiogram, say 20%, then it becomes 50, over a period of time it's 70, maybe 90, 99, and then it becomes 100%, causing block. So that's one. The second could be a dissection of the artery. There are these three layers: intima, media, adventitia. So there is a dissection between the intima and the media, and there is a flap of the intima which blocks the artery, which is seen in the angiogram, as you can see there. So there is a sudden blockage. So that can cause a heart attack. There could be a severe arterial spasm. Spasm is a severe contraction, and this is very common in patients who are consuming a lot of nicotine, either by oral tobacco or by smoking. So this nicotine is known to cause sudden spasm. And if this spasm is relieved within the first 6 hours, the muscle will be saved. If it is not relieved, there could be a permanent damage to that muscle or that segment of the heart. The next could be, there could be a clot in the artery, especially in patients with hypercoagulability states where the blood tends to thick faster. So if a patient has some damage to the inner lining of the artery, if there is a little endothelial dysfunction, and hypercoagulability state can cause a block by a coagulation, by a clotted blood there. And well, this can be relieved very fast by thrombolytic agents and certain medications. Next, there could be a bleeding in the plaque. The plaque is a blockage which is due to cholesterol and so many other substances, and it is active either in a soft plaque, and especially in the soft plaque there could be a bleeding. If it bleeds, then there could be a sudden blockage of the artery giving rise to heart attack. And lastly, there could be a combination of one or two factors together giving rise to heart attack. So these are all the various reasons why heart attack takes place. So these are the basics. So friends, anything and everything in life can wait, but not the heartbeats. Keep your heart beating.